Hello, everyone. Welcome to the GLP-1 Hub podcast. I'm your host, Anna Reisdorf, registered dietitian and GLP-1 user. Today, we're going to talk all about GLP-1 and longevity with Dr. Fermin Barretto. It's going to go way, way beyond weight loss about all the additional benefits you might find for your brain health and for living longer. So I'm really excited for you guys to hear this conversation. But first, we have a sponsor of the podcast today. I want to introduce you to Relisium. If you're taking a GLP-1 medication like Ozempic, Wegovy, or Mounjaro, you already know how powerful these treatments can be for weight loss and blood sugar control. But the digestive side effects like nausea, bloating, constipation can make the journey pretty tough. That's where Relisium comes in. I recently learned about Relisium, a first-of-its-kind supplement specifically designed to support gut health for people using GLP-1s, and now I want to share it with you. Relisium is clinically proven as it uses a patented blend of antibody-rich dried eggs, bovine colostrum to help ease GI discomfort by neutralizing unwanted microbes and toxins in the gut so you feel your best and don't feel nauseous, constipated, or bloated. And the good news is listeners of the GLP-1 Hub podcast get 10% off their first order with the code GLP-1 Hub 10. That's GLP-1 Hub 10 at relisium.com. That's RELESIUM.com. So start to feel good from the inside out with Relisium. Let's get on to the episode. Hello, everyone. Welcome to the GLP-1 Hub podcast. Today I have Dr. Barretto here from the LongJuve Clinic, and I want to let you introduce yourself. Thank you so much for being here. Can you tell us a little bit more about your practice?
Sure. So first of all, thank you for having me on, and it's great to be here. My name is Dr. Fermin Barretto. I'm board-certified in emergency medicine and medical toxicology. I've spent a career taking care of patients at the end stage of illness, and now I'm converting my practice on preventative care and longevity. We have, I'm both co-founder and medical director of LongJuve, wellness, aesthetics, and anti-aging. We take care of everything from skin rejuvenation to hormone replacement, as well as, of course, aesthetics, injectables, fillers, and weight loss.
So that's a pretty big shift from longevity to, or from end-of-life care to longevity. So what happened there that you made such a big shift in your career?
I think for myself, it's been a progression. I've trained through medical school. Have actually trained in medical toxicology, where we study the drugs, the adverse effects. I see what we do with regards to patients and treating everything in all of these disease entities, and we really don't tackle diet. We don't tackle the important things that we can do to prevent illness. Mm-hmm. And then as far as longevity, enjoying our lives and being able to actually improve the quality of life is another area that I've become very interested in. And then I also know, there's it can be sometimes a little bit of the Wild West out there, and I can add a certain element of safety. So knowing the adverse effects of a lot of these therapies and being able to make sure that we push towards not just effectiveness, but also safety.
So how do the GLP-1 medications play a role in your new practice for the longevity piece of it?
Oh, there's so many different
components
to that. So that one could take up the whole 30 minutes. But
sure.
I think the GLP-1s have been a huge game changer. And the big thing to understand is there are GLP-1 effects that happen to the brain as well as the GI tract. And then there are impacts from just general weight loss. And people confuse the two all the time. So, when we talk about GLP-1s and their incredible impact that they have had, when you deal with, obesity and overweight people, there is a certain amount of chronic inflammation that lives within the adipose. Mm-hmm. So if you have that problem, you have an increase in chronic inflammation with it, which I think a lot of people understand can lead towards a lot of different problems. Everything from cognitive decline. You see people with autoimmune disorders. I mean, you can go down the list, and there's a lot of problems that occur with this chronic inflammation. GLP-1s help decrease your weight, which thus decreases your chronic inflammation. So that is one actual impact. The part that's actually equally exciting is the impact it has on the addiction pathway. So GLP-1s actually impact the hypothalamus and the hindbrain. This is like your fight or flight area. And these are the areas where you have your positive feedback loops for smoking, for drinking, for opioid abuse, cocaine, all of these different addictive pathways. But I can even bring it back to something real basic. You ever, you're in a party, you got the table full of snacks, and you start reaching and eating, and you don't even know if you had a little calorie counter, right above my head. I mean, that thing would be ticking 100, 200, 500. It just becomes habitual, almost social, as you're sitting there talking or you get those cravings. There's late night craving. Everyone knows about there's college students, at, late night, after a night out where they've had alcohol, decreased inhibition, they end up eating a whole bunch of junk food. The same thing happens with adults. We end up having these cravings. You can almost call it food noise. GLP-1s, very interestingly, take away the food noise. So that craving that you have for that snack or for that drink or for that cigarette, it ends up going away. And that's the exciting part about GLP-1s. The best way to describe it. So you have bariatric surgery. This is where they literally cut out a piece of your stomach, right? That single impact does not take away the cravings. It makes you feel full. In fact, some people, there's been some research that shows you actually replace your food addiction with another addiction.
I used to work with those patients, and a lot of them became alcoholics, sex addicts, all sorts of things after.
Yep. So you have bariatric surgery, which has 20-25% weight loss, but there's a failure rate on bariatrics. GLP-1s. The amazing part about this is you're seeing decreases in alcohol use, decreases in smoking, decreases in opioid abuse. It's triggering a whole new other set of research now for GLP-1s in the addiction pathway, because this is something that people did not realize. So you actually decrease the addictive personalities or the addictive behaviors with GLP-1s. Bariatric surgery, you don't. So that's one big difference, right? And so that's why they're actually looking at using both of them now to be able to help drive down weight loss.
So I have a couple of questions about that in terms of changing the pathway for the addictions. And because some of those things, they boost a big hit of dopamine, like alcohol, and it's like a feel good thing. So I've seen, as I've been writing a lot about side effects of GLP-1s, and I've seen a lot of things come up about depression and suicide and maybe lack of pleasure in life. Have you seen anything about that? Like maybe it's changing your ability to feel pleasure in some way?
So I've read some of the anecdotal reports. I don't know that it's actually played out in the research as strongly a signal to the point where, it becomes a complete contraindication. So I know that it's out there, but at the same time, it actually has been shown to actually improve actual mood. There's actually, even in cognition, normally when there's depression, there's also a parallel cognitive decline that can occur. With GLP-1s, this one I think is a little messy. If you actually have weight loss and you decrease your inflammation, you can actually see cognitive improvement as early as 3 and 6 months. They actually did this. Now, they used GLP-1s, but they showed actual cognitive improvement for patients. They tested them right before at 3 and 6 months, and as short a time as 6 months, they actually started to see cognitive improvement. Which, is it because of the GLP-1, or is it because now you have gone through this weight loss and decreased the chronic inflammation that occurs within the adiposity of your abdomen? So, that's going to be a little bit of a question, and that's why it gets blurred. You have two different impacts, and is it really depression secondary to GLP-1s? I can see the connection where you might be able to make that. I just don't think it's clear yet.
I remember I worked with weight loss, in my dietitian job. And I remember that people would lose significant weight on some kind of medical weight loss program. And then they realized that their lives didn't really improve. And that was difficult for them because they thought, well, it's the weight that's causing my husband to not like me, or for my, all these things. And then that it didn't change. And I think that there was a lot of mental stuff that came up for them when that happened. So it wasn't what they expected would happen.
Yeah, the biggest mistake anybody can make is that GLP-1s are some sort of magic bullet. They are not. And that's why, and in particular in our clinic, we really work towards customizing and personalizing care, because, your particular instance that you're talking about, look, if there are marital problems, it's probably bigger than your weight. And if you don't have counseling to go with that, now that's not necessarily something we're doing in our clinic, but But I would make that recommendation. We would try and dive into it, and maybe we work collaboratively, but each person is a little bit different, but understanding the science behind the GLP-1s can help you kind of predict and shepherd the patient through their journey. More often than not, I mean, when you go through, so I spend a lot of my time in the hospital service line sectors. A bariatric program actually combines the medical weight loss with behavioral health, diet, and exercise. These are all your basic tenets for weight loss by itself. Remember, behavioral health was one of those 4 tenets. So you definitely have to take into account where the person is in their mental health to be able to sit there and make sure that the diet is or the weight loss is going to stick.
Right. So in terms of the brain changes that you see, do you think that these could be made permanent even after you get off the medication? Or do you think that you just got to have a little bit of GLP-1 on board forever to stop your drinking or whatever it is it's doing for you?
So I think, we're going to learn more and more about these drugs. But the one thing we definitely know is once you come off of the medications, your chances for regaining the weight and restarting your bad behaviors, unfortunately, go up pretty significantly. Just think about, someone who's trying to quit smoking, right? They can try different medications. They can try the patch. If they don't change what is going on inside the brain and break that habitual habit of, hand to mouth, the social aspect, their friends, if you don't break those cycles, it's very difficult for any one medication to do it all for you. So can you do it and can you maintain it? Absolutely. But right now, I mean, that's why there's a lot of new advances of how do we increase the duration of action for these medications or change it to an oral medication, which is a little more palatable than a weekly injection of semaglutide or tirzepatide.
Sure. So in thinking about longevity, like how are you dealing with that with your patients? Do you taper the dose down? Are you playing with how many days between medications? Like how are you dealing with that sort of thing?
Great question. And that's where you really get to customize these things. You can titrate these medications, and sometimes you have to go slower. Sometimes you get the adverse effects, especially as you're titrating up. And the most common adverse effects, of course, are nausea, vomiting, constipation. You have to take into account everything. So yes, you can titrate all the way up. Sometimes you take it down a notch so that you can maintain whatever they have. So yes, it is titratable to the person and their goals. Mm-hmm. As well as, again, the adverse effects, which most commonly occur during the titration piece.
So how do you help them handle some of those adverse effects? Is there anything specific that you tell them to do for those GI effects or recommend or give them?
So the GI effects are helpful in knowing how you're tolerating the medication. It is okay to, treat it with Zofran or other antiemetics, but it's also helpful to kind of know, all right, as long as you have to see how they're feeling. I mean, if they're actively not feeling well, you're going to just stop the medication, treat their symptoms, and get them through that. And then sometimes you can try at a lower dose. Sometimes you can try, you flip from one to the other. But sometimes, the medicine's not going to work for them. So, and some people say, you know what, this is not for me. I just can't do it. So yeah, you have to take all of that into account. If they're tolerating it well, but they have some nausea, you can get them over the hump, but you're certainly not going to stay on antiemetics. It's basically for that episodic nausea and vomiting that may be occurring in the first 24, 48 hours after a titration.
And so do you find that it's when they go up in the dose as they get used to it, and then like once they stay on that, it tends to get better?
2 different times. The very first shot, sometimes you'll see that nausea and vomiting, and then on the exactly. So you're going from the 0.25 to the 0.5 for the semaglutide, and then that first 24 hours, as they begin to acclimate, they may get some nausea, and so it's that initial titration phase where you feel it. Usually, after you get through that first week, they're able to tolerate it. It gets better.
Okay. And are there some people that just can't tolerate this medication at all? I've had a couple of people tell me that.
No, absolutely. And that's where it is helpful to, be dealing with a provider that understands the other ways that we can get to the weight loss. I mean, there have always been other medications that they're just none of them have been as effective as the GLP-1s, and none of them have had this amazing reduction in these cravings. And we really have to think of GLP-1s. I'll give you a great story. I had a doctor friend of mine, intelligent guy, who literally came up to me and said, these GLP-1s, they just make you lose weight by making you vomit all the time. And I'm like,
Giving people bulimia, one person at a time.
So, I mean, but that's some of the myths that are out there as it relates to GLP-1s. That's not, what is really happening here. So there is a GI slowing, a GI impact, but that's actually not the main impact of all this. But that's where you get the nausea and the vomiting. The craving piece is really the amazing part, and where you have to think of it as a neurologically active dopamine pathway activating, neurotransmitter. It impacts the brain. And that is why we have seen such incredible impact. And then the next piece, for those that tolerate the medication well, you have to change your mindset, because now, okay, I don't have the cravings. Your diet and the number of calories you're going to take in each day is going to be decreasing. You actually have to think about your diet balance and how much protein are you taking in, how many carbs, and how much fat. Because if you try to continue what you were doing previously, then you're going to see that protein wasting. You're going to see what they call the Ozempic phase. And if you're doing it at a rapid order, then you're really talking about maybe some aesthetic results that you weren't, shooting for. And that's where, we come in to be able to assist with that.
So what are some of the ways that you can help that? Because Ozempic face was one of the things I wanted to ask you about, since you're doing aesthetics work as well. So are there any machines you can use, injection creams? I don't know.
Yeah. Well, let's start. Let's start from the diet piece. We'll talk about the skins, and then we'll talk about the procedures. So right out of the gates, you've got to double your protein. I think it's around 1.8 grams per kilo that you're trying to increase your actual protein amount. The mix of your protein versus your carbohydrates, you almost literally have to double up your protein ratio. That will help decrease the chances of you getting what people call Ozempic face. It's not that the GLP-1s attack your proteins and suddenly break them apart. So that's another myth that's out there. This is really both diet imbalance and weight loss occurring at the same time. And then, of course, if you're older, you don't have big collagen stores, your skin may be a little bit more saggy, wrinkly, and the impact may be more noticeable for you. So diet, that's the first piece. And making sure that the weight loss is in a controlled fashion. When you go too fast, there's just not a lot that's going to help you out at that point. Let's go to the skincare piece. And all of that is going to be related towards making sure you're staying well hydrated. You have, skincare products, and making sure that, and that's when we bring in our estheticians and our providers here to be, help you out, make sure you have the results that you want to shoot for. And then, of course, we have RF and microneedling and what we call tri-lift, and that's really helps produce collagen and tighten the skin. That's another way that you can go. Skin rejuvenation. Of course, we have the Cyton laser and Moxie, which I think a lot of people know, and helps with skin rejuvenation as well. So you work through a lot of those different procedures, and we're able to have results that really combat that weight loss that may have occurred.
Sure. So what about the skin on other parts of your body? Because I've seen a lot of people when they're very overweight and then they lose a lot of weight. There's significant, obviously there's surgical procedures that you could do for that, but anything.
Yeah. I mean, when you start talking about that type of, weight loss as well as, skin that actually needs to be taken care of, then you're talking about plastic surgery. And, of course, we can make recommendations for that, but not something we do here. Usually those are, you don't have many more options left, when you have that type of weight loss. That's usually in your BMIs above 30 that you're dealing with, and big weight losses. So 15% of a 300-pound individual would, you're talking about upwards of 50, maybe 60 pounds of weight loss there. So and then usually you don't do anything unless we know that the weight loss is going to stick, and that you've proven over a year or two time that you are going to be able to maintain that weight loss. Because of course you don't, if the person is not showing stability in their weight, then the plastic surgery could it may not work, or you may have bad results.
Sure. And so just want to talk a little bit about some of the rumor severe side effects. Sometimes I read the YouTube comments and people are like, enjoy your blindness. And it's going to eat your heart muscles, and your stomach will be paralyzed forever. So how much of all that is true?
All right. Yeah. So I think I already mentioned, so it doesn't attack your proteins in your body. It doesn't attack your muscle cells in your body. If you had a bad diet before and you take a GLP-1 and you don't adjust your diet, that's going to get accentuated. because you're now taking fewer calories. The body will break down protein when it is in a starvation state. So that will absolutely happen. So as much as they want to blame it on the GLP-1, this is actually self-induced from your diet. Heart muscle, skeletal muscle, either one, I think that basically applies to that. What was the other part?
There was a study about blindness.
Yeah. So I think there was a retinopathy one, and then there's another study that actually showed that it was actually helping out in glaucoma. So I think when you're dealing with diabetics can have diabetic retinopathy. They have increased risk for glaucoma. When you are actually using GLP-1s in the setting of a type 2 diabetic, then you're talking about a different animal than what we usually treat here in LongJuve. You're working in coordination with your endocrinologist. Diabetics in general, when they are on the GLP-1s, they do extraordinarily well. I mean, when you start seeing bariatric surgery, I always had a bariatric surgery friend of mine who actually said, look, this is the only surgery that cures hypertension, that cures diabetes. You get them off the medications. Well, guess what? GLP-1s are the first medication that I have seen that actually cures hypertension, cures diabetes. The downside for diabetes specifically is they are already at risk for retinopathy. If they have big drops in their blood sugar and their hemoglobin A1Cs, in those studies, it is showing that there could be some problems with their eyesight, and it needs to be monitored closely. And, I think the theory in general, and this is a little bit out of my wheelhouse because you're really getting into diabetic care, but I believe it's in relation to how quickly the glucose is actually being brought down. But again, probably a little bit more into the endocrine pathway than perhaps what I'm trying to take care of here.
Right. And then the last one is, what about the stomach paralysis? I know that there are some pending lawsuits out there, and it's complicated.
Yep. No. I mean, I think gastroparesis is a real thing. The exact mechanism, I'll give you actually, THC, what has now been legalized, marijuana. The high doses there have caused something called cyclical vomiting syndrome, which is essentially where the stomach doesn't move and you just continue to vomit incessantly. You stop the marijuana, the stomach can actually start moving again. But for some, it actually doesn't back. For GLP-1s in the lawsuits, and I haven't read too many of the lawsuits yet or the case studies, but gastroparesis and that vomiting, I've even seen it in the emergency department and cared for those patients. Most of the patients that I hear of, you take away the GLP-1 and the stomach comes back and you basically get around, or the gastroparesis goes away. The lawsuits, I believe, are saying that the gastroparesis did not go away. And is that possible? The incidence seems to be extraordinarily low if it's really happening. And so I think we're going to need more data to see. Now, the interesting thing is GLP-1s have actually been out for several years. So we're getting more and more data out there as it relates to that particular adverse effect. But remember, gastroparesis not going away, once that happens, that is a very difficult diagnosis. You get into malnutrition. You have to actually have some different surgeries to be able to bypass the stomach if that's the case. When you are talking about, there's another adverse effect called pancreatitis, and that's something to be wary of. And that's where you have pain in the center part of your stomach. Again, you take away the GLP-1 though, and that should go away. There are a bunch of medications, actually, cholesterol medications and patients with high triglycerides that can lead to pancreatitis. So it's an adverse effect of some medications that we know, and in particular, GLP-1s can cause that. And of course, multiple endocrine neoplasia and thyroid cancers are things that we have to be careful of, and GLP-1s. So there are several things that we need to consider, and I've never found a medication that is 100% free of adverse effects. What to look out for. And, I don't know the stories too much on the gastroparesis. Did they continue to titrate up despite adverse effects? Did they cover them up? What was going on with those patients specifically that they ended up having this terrible, effect? Definitely, more to come. But is it out there? And are there lawsuits? Definitely.
Yeah. I think there's always more to the story sometimes. But one final question for you, Doctor, is what is the future for these GLP-1s and maybe even the peptides in general? A lot of people seem very excited about all of that.
Well, there's GLP-1s, there's GIP, so tirzepatide is both GLP-1 and GIP, and it impacts both parts that are contained within this same pathway that we talk about satiety as well as hunger. Tirzepatide is actually more potent than semaglutides Where you get a 15% weight loss with semaglutide, you can get a 20% loss on average with the studies with tirzepatide. The kicker, again, we talked about, weekly injection. They're talking about either a monthly injection or an oral medication. So are they able to formulate it in a way that allows you to take it by pill? Both of those, I think, would be game changers. Of course, the pill may even be more so because it becomes so much easier to take. So those are two of the big initiatives. And then these other indications for utilization. There's liver diseases where there is fat deposition in the liver. Mm-hmm. And we are seeing patients. I would expect the indications to actually change soon related to, that disorder. Addiction, again, is going to be one of the great, research pathways. And then lastly, this cognition piece. And we're seeing patients with Alzheimer's, patients with Parkinson's that are having improvements in cognition secondary to the GLP-1 utilization. Mm-hmm. So again, is that the weight loss piece or is it GLP-1? I think remains to be seen. But, when you talk about longevity, you talk about anti-aging, you talk about improving your quality of life, those are exciting developments for.
So if you're at risk for some of those brain degenerative illnesses, do you recommend somebody taking a dose of GLP-1 as a preventative thing or only if they really need weight loss or something else?
So we don't have FDA approval for that. Yeah. I mean, people do use off-label medications. You also have to know where people are with regards to their overall weight. But, right now the FDA, approved indications is BMI greater than 27 with a comorbid condition related to obesity, which can be hypertension and diabetes. And then, of course, anybody above BMI of 30. Now, unfortunately, probably close to 60% of the patient population out there actually qualifies for GLP-1s in some way, shape, or form just with that alone. But that's why we need the research to actually say, is it worth taking on the adverse effect profile? And if you are at risk for Alzheimer's dementia or Parkinson's, does it become, an initiative to help either push out when it starts for you or prevent it from even occurring? Mm-hmm. There, not yet. I think the most exciting piece for me was that cognition improvement in just such a short period of time. We talk about, I wish I could just take a smart pill, right? That would be great. But, if you literally are improving your cognitive ability by simply going through this weight loss and decreasing the chronic inflammation within your adiposity, as well as maybe some GLP-1 direct impact, I think that's extremely exciting.
Yeah, definitely. Definitely. I'm excited for the future and what new discoveries come about with this. And I want to thank you so much for your time, for being here. This was a great conversation. And I'll put all the information about Dr. Barretto on the show notes so you guys can learn more about his clinic and what he does. Thank you so much for listening to this week's episode of the GLP-1 Hub podcast. I hope you learned a lot because I know that I certainly did. And make sure that you are subscribed and following along here on the podcast. We love reviews also. So if you can drop a review of the podcast, I would be so grateful. And come on over to our Facebook group. It's called the GLP-1 Hub Support and Community. We'd love to have you in there. And finally, a final word from our sponsor. Be sure to check out Releasium, supplement clinically proven to support gut health for people using GLP-1s. If you want to skip the bloat and say goodbye to nausea, head over to Releasium.com and use that code GLP-1 Hub 10 for 10% off your first order. That's Releasium.com, RELESIUM.com to support your gut and stay on track. And I'll see you next week.